Good morning, everybody. Again, this is John Scholes, President and CEO of the Downtown Seattle Association. And first off, we hope that you, your teams, your colleagues, your friends and family are safe and healthy right now. And like you, we've had to adjust as an organization and adjust our operations and also how we serve you over these last couple of weeks. And we know for likely many more weeks to come. I wanted to just speak briefly to how, as an organization, we've pivoted around our work to serve our members. This webinar is a part of that, of course, but our focus really is in four areas going forward. One, we want to track and understand the economic impacts to downtown from the virus across sectors, nonprofit and for-profit companies. We want to understand what those are, and we've been tracking those closely. Number two, we want to be a voice and advocate for you, our members, the downtown community, our companies, our great nonprofits, our arts and cultural organizations that have been hit hard through this. We want to be your advocate for relief, investment to help you get back up on your feet in downtown as well. Number three, we want to be a source and a resource to you to help digest all of the relief efforts that are coming from local, state, and federal officials. There's a lot of legislation being adopted. We want to be a source for you and to help you understand how to access those resources as a small business, as an arts organization, as a large employer. And we've been going through that information in detail, created some unique pages on our website, and will continue to be a resource to you. And then fourth and finally, we want to start planning now for the recovery. There will be a recovery. We will get through this as a downtown. So we are already thinking over the horizon with our partners and other interested entities in our downtown about how do we support a recovery to downtown, a recovery for our members, business, and nonprofits. So that's how we've pivoted over this period. We welcome input and feedback from you and how best we can continue to serve you as our members in the weeks ahead. Really pleased with the strong turnout and interest in this webinar. Several hundred folks joining us today, including a couple colleagues from downtown organizations from Vancouver, I know, Washington, D.C., and Virginia. We're all trying to learn from each other and how we can help our markets, our downtowns, and our members get through this. Emily mentioned a couple of the housekeeping items. We're going to start with about 10 minutes with each panelist, and then leave plenty of time for questions that Emily will moderate out of the Q&A box. We do have a few members of the media that are joining us today, and we just ask you to treat all of this on background, and then if you want direct quotes from any of the panelists or myself, if you would just follow up with us directly if you're looking for direct quotes. But we ask that you honor our request to just treat this information and discussion on background. So with that, I will introduce our panelists, each of them very busy people, and we are really grateful that they're giving up some of their Friday morning to be with us. First off is Rachel Smith. Rachel's the Deputy County Executive for King County Executive Dow Constantine, and has really been on the front lines on the public health side of this over the last several weeks, and has worked over nearly 20 years in public affairs, government relations, and advocacy roles within our region. Chris Mefford is the CEO of Community Attributes, a firm he founded in 2005 that provides economic analysis and strategic planning to major economic issues within our region and others. And Sean Bills is the state director for Senator Patty Murray. He has served Senator Murray for 16 years in a variety of capacities, including as Deputy Chief of Staff. Really appreciate each of you joining us today. We're going to start with Rachel, and I just want to start by commending Rachel for some incredible work on behalf of the county executive over the last 3 weeks. I've been on phone calls with her nearly on a daily basis, and she's really made herself available to the private sector, organizations like ours, the nonprofit sector, to ensure that we're all getting the best information possible on the county's public health response. There's a lot to cover here, and we asked Rachel to sort of give us a status update on a couple of issues, testing being one of them, data and modeling. Are these social distance guidelines that we're all following, are they working? Are we starting to see some benefit? And then to also address the concern I think we all have for our healthcare workers and our healthcare system and the availability of personal protective equipment and whether we're making headway there. So Rachel, hope you could give a 10,000-foot overview on some of those issues, and maybe we can fit a few others in about a 10-minute period.
You got it. Thank you so much, John. And it is a pleasure to be here virtually with everybody this morning. I want to just echo what John said about hoping that everybody is safe and that your families are safe. And obviously just say that, you know, our hearts continue to go out to those individuals who have either lost their lives or lost loved ones due to this disease. So I'm going to cover what John talked about and probably a couple of other items here. I want to just start by sort of grounding us just really quickly in some of the basics. So COVID-19 is a respiratory disease. I think most folks know that. As a reminder, many individuals who get this disease will have mild symptoms. And really it's those individuals that we have categorized as vulnerable. So folks over 60, folks who have underlying medical conditions or are immunocompromised, that are the individuals that are most at risk for having really serious complications with the disease. Most of the symptoms are things like fever, cough, difficulty breathing. And I think everybody knows this, but because I am obligated to say it, everybody needs to stay home when you're sick. You know, we encourage folks to be washing your hands, sanitizing surfaces, and doing everything that public health has thus far guided us to do in terms of keeping yourself, your family, and others safe. So I'll cover the couple of things that John mentioned just right out of the gate. So on testing, this has obviously been a huge issue, not just for our community, but for communities around the country. I want to remind folks that there are sort of three parts to testing, any of which can be either the barrier to getting more testing done or you know, something that we have to overcome. So the first is the administration of the test. So obviously you need the individual or the medical person, or if it's, you know, a personal test or whatever, that sort of test administration is thing one. Thing two is the test material itself. So the swabs and the media that you need to actually take the test. And then the third is the lab analysis. I will say that as of right now, local lab capacity is not one of our limiting factors here in our region. Typically, what we have been doing is hospitals, King County Public Health, cities, others, we are ordering our tests directly from FEMA. That is how we have received most of our testing supplies to date. Obviously now with the spread across the country, FEMA, getting those materials is really a challenge at this point. And you have a lot of jurisdictions, including our own, sort of all jockeying to be able to get those materials. So that really has become a problem. We were obviously very encouraged when the federal government was planning to provide thousands and perhaps tens of thousands of additional tests to our community. But I will just be candid in saying there have been a number of barriers to us being able to get those tests and get that moving. I won't go into a lot of the details, but we'll give an example. So the federal tests that just came out that we would be receiving here have to be sent back to a lab, and that lab takes somewhere between 4 to 5 days to do those tests, where here locally, our own capacity, we can turn those test results around in 1 day. So we're continuing to work with the federal government to try to get those tests and make them available in our community. But I did want to say that one other good thing that has happened recently is that the FDA just approved the home testing kits. So that should also help our testing capacity here. We really are focused on being able to do the testing that we need locally here in our community, which means we need access to the resources, we've got the lab capacity, and so that we can really get to the level of testing that we need here. Also wanted to touch on what John mentioned related to personal protective equipment. This is another huge barrier in our response to this disease. PPE, as it's known, personal protective equipment, is essentially distributed and handled entirely by the state, although we are in conversations with them all the time and do some of the distribution based on what they have directed us. So, and that distribution goes to all of the health jurisdictions. So DOH essentially determines how much of the PPE our region gets, and then King County distributes that PPE in what we receive from the state based on a set of tiers that the Department of Health and that King County Public Health have laid out. Requests are collected locally in a couple of different ways. So for all healthcare facility requests, those come in directly to King County Public Health. For local jurisdictions, City of Seattle, City of Redmond, et cetera, those come in via the Office of Emergency Management. And then our first all of that gets organized through our EMS system here at King County. So all of those requests come in, and then they go to the state. The state looks at those, coordinates, and then sends that PPE back to us, and then we distribute it out to all of those entities that I just discussed. Because we are limited in PPE, we have these tiers of prioritization. Obviously, healthcare workers are at the top of that list. First responders are at the top of that list, vulnerable individuals at the top of that list, and then the tiers go down from there. Talking a little bit about numbers, one, I will let folks know that our numbers as of end of day yesterday, we have 1,577 cases here in King County. That is up 218 from the day before. We also have 109 deaths. That is up 9 from the day before. Also, we have 10,733 negative tests that have come in for folks who have been tested there. I also wanted to let folks know that King County Public Health has just launched a new dashboard that has a lot of the numbers information that I'm going over here. It also has trend lines. It's really, I think, a useful tool for those who are interested in understanding exactly what's happening to the extent that we can. So talking about that for just a moment on numbers, I think there's sort of two things. There's the data we have, and then there's the modeling that is going on here locally by our own experts. So on the data we have, the actual number of positives that we have, it is currently looking fairly stable and does not appear currently to be going up exponentially as we have seen in some other communities. I have to put a very strong caveat on that in saying that we do not have the testing capacity in our region that we need. And so that could be skewed in some ways based on that lack of testing. But that is, you know, very tentatively good news for our community. On the modeling side, what has been done by our local experts, and again, we have to caveat also that models take in a lot of assumptions that we know are not exactly reflective of what goes on the ground in our community. But that said, the modeling that we're seeing does suggest that we are flattening the curve. Some of the modeling we have seen shows us potentially flattening the curve quite dramatically. Our public health officer, Jeff Duchin, actually said to me yesterday that he is feeling very confident that the community mitigations that we have in place right now, both here locally through public health orders and with what the governor has ordered, are having a significant impact on decreasing the spread of the disease, even if we can't measure that precisely just yet. And I do think, and you heard the governor echoing this yesterday as well, because of that, because we are, you know, cautiously optimistic that we're seeing things working, we likely will probably have to go longer with the community mitigations that are in place right now. I wanted to talk just a little bit about a couple of other items, and I'll just kind of click through these quickly, and if folks have questions, those please send those in and we can talk a little more at length. I wanted to mention that I think folks probably know that King County has been also working with our partners at the City of Seattle and others to stand up a number of different facilities to support us in this crisis. So isolation and quarantine facilities, what we're calling assessment and recovery facilities. And then we've done a lot of work with the City of Seattle on de-intensifying our shelters, so really spreading people out identifying those who are most vulnerable in our shelters and getting them into a different location so that they are less likely to contract the disease. And all of those, again, are those kinds of community mitigations that we're seeing to hopefully not have like really concentrated outbreaks as we have in some of our long-term care facilities. I also just want to give a thank you to the state of Washington on those long-term care facilities. So those are, of course, overseen by DSHS at the state, and the governor has recently stood up an incident command really specifically to work with those long-term care facilities. So we are appreciative of that. Standing up all those facilities, I will say the barriers that we have there, number one, staffing, number two, PPE. So those are going to be, while we're working fast and furious to get the actual infrastructure stood up, those two issues are going to be ones that we're going to have to contend with. I'll also just touch briefly on transit. We have seen as of yesterday about a 65% reduction in ridership. We have moved to what we refer to as sea-level cuts in most places. That's about a 23% reduction in our service. We have really made sure we focus though on keeping service going to essential public facilities, things like hospital, things like the University of Washington. We've also done some mitigations with our own service. So we are having all folks board through the rear doors to reduce for our drivers the opportunity to have interactions, and then also have no fares so that we don't, again, have that interaction with bus drivers. And then just touching on a couple of other things. One, childcare. We know this is a huge issue. This is not something that King County does a lot of directly, but we are working with childcare facilities, making sure they have the resources they need, that they understand what they need to be doing in terms of sanitation and things like that. We're giving them guidance, and also working with a lot of our partners to try to make sure that our first responders and that our healthcare workers have access to childcare. That is critical right now with the schools closed. And then also wanted to touch on what John mentioned on the hospital surge capacity. So there's a lot happening in this space. I think folks may have heard that the federal government is talking about bringing some field hospitals here. We are being as cooperative and collaborative as we possibly can to get that moving as quickly as possible. We're also working with some of our other hospital partners to look at, for some of the facilities that we're standing up, could we have some medical services in any of those that could be helpful to our hospitals? And I think, while we haven't seen sort of the breakdown of our hospitals yet, there are many COVID cases, and our hospitals are struggling, and they are also struggling with the things that public health workers are, which is PPE as well. That lack of PPE, that lack of testing is a theme that you're hearing through everything that we're working on right now. But we are really working closely with our hospitals to make sure that we are prepared for the surge and critically ill patients that are likely to show up at the hospital. I want to say thank you to the business community. We have had just such an outpouring of support and people coming in and willing to donate things to help us. That is so appreciative, and we have set up kind of a whole system now where we can take in donations and be able to do that really seamlessly and put those donations to work as quickly as possible. We've gotten PPE from Facebook. We've gotten non-perishable food. So we just are very appreciative, and I wanted to take the opportunity here to say thank you. And then the last thing I'll just mention is on kind of the recovery. Obviously, we here at King County are still deep in the crisis. That being said, the executive has directed us to make sure that we are beginning to look forward on how we can work on the recovery. We are going to really try to coordinate with all of our 39 cities here in King County to kind of launch some kind of recovery effort while many of us are still in crisis mode. To get that going, we are hoping to next week or so. Also deeply appreciative of the business communities, our partners at Commerce at the state, Seattle's Economic Development Office, and the business community directly, and all the work that you're doing on recovery. And I think we've got some ideas of things that we can do in King County, but really we need to have a community conversation about how we're gonna relaunch our economic activity here. And then the last thing I will just say is one of the things that is very real for us here at King County is we have got to have a renewed conversation about funding for public health. These kind of crises remind us how critical that is. And we as a local government, regional, state government, and federal government have got to focus on that. So again, thank you all so much for the opportunity to be here today. And I will stop there and turn it back to John.
Thanks so much, Rachel. And you mentioned the great partnership between the public and private sector, and would agree that that's been one of the silver linings here, that when we need to, we can do that well in this region. And thank you for all of your leadership over the last several weeks in a really difficult and challenging crisis. You mentioned the great dashboard that King County Public Health has produced, and I've got a hard copy here, but we will send a link around in the post event survey. It's a great resource and very easy to understand and track all of the data around the public health side of this crisis. I want to turn now to Chris Metford, the CEO of Community Attributes, and ask Chris to give us sort of a thumbnail on the economic impacts to date at a regional level from the virus. We really, in our downtown, in our region, were one of the first, if not the first, to really feel not only the public health impacts, but the economic impacts from the virus. And we saw that play out very quickly in the downtown and really ripple across our region. And it's been devastating to see so many small businesses, arts organizations, and others have to close their doors and in many cases lay people off. We've asked Chris to give us a handle on the regional implications, what we're seeing now, and then to the extent possible, his perspective looking forward over the horizon and the potential additional economic implications from the crisis. So thanks again for joining us today, Chris.
Yeah, thanks, John. How's my audio? Is it okay?
It's not bad. I'd say okay.
Okay. Let's see if I can do something better with that. Just 1 minute here. Try. Whoops. Bear with the story of the week, right? I'm trying to reset some of these things. Just 1 minute.
It's. I think.
Is it all right?
Yeah, I think we can hear you if you don't have a quick fix on it.
Okay. Thanks. Okay. Thank you. Well, thank you, John. Appreciate your leadership on this topic. I am going to talk as little as necessary to set the stage, and I'm happy to go in different directions if you'd like. I'm going to walk through, I'm going to share a screen here in a minute too, if that's okay, John, just to organize my thoughts a little bit. It stems from a paper that the Seattle Chamber of Commerce commissioned us to lead. They commissioned us to write, excuse me. They reached out to us on March the 2nd, which was just a couple of days after the first positive case was found in Washington State, which at the time felt like a rather theoretical exercise and less focused on the US and more focused on the global supply chain and China. And of course, day by day from then on, as the crisis became more and more real in the Seattle area and the United States, it moved very painfully from a hypothetical exercise to trying to keep up with anticipated impacts. So apologies in advance for the morose nature of the work that we've done, and we'll certainly try to end with some constructive thinking. And per John's point, it's really, I think, timely to start thinking about what does recovery look like, even though we're many days away from knowing when the recovery might start. It's important to start thinking in those terms, I think. Okay, I'm going to try to share this. So I believe everybody can see this. John or team, please let me know if there's any concerns. There's not many slides. I won't drag you through all of these details. I encourage you to read the white papers published on the Chamber's website. We just wanted to set the stage to trace through what are the impacts we're actually talking about. And so we wanted to understand, in order to separate and distinguish the virus impacts themselves and the medical and public health reaction to the virus, to understand what are the economic impacts coming from. So this slide sort of sets that stage. And at the time, like I said, it was sort of hypothetical in nature. If businesses start to close, or if factories are disrupted and those things, what would happen? And of course, as we all know, those events now sound like old news and certainly not hypothetical in nature. In a similar way, we wanted to anticipate what were the economic impacts expected to come. And it was not a worst case scenario conversation, unfortunately, although certainly some of the feedback we got when the paper was initially published was that we might be too pessimistic, being too dour. And unfortunately, no one is saying that about the way we wrote this up now, because those very real challenges have played out. But it's useful to sort of understand how we got to this point, so that when we think about putting the pieces back together, we can flow through and think about, okay, what needs to be restored? And probably the biggest concern that escalated everything has to do with that fear and uncertainty piece of the economic reactions. There's nothing businesses and markets hate worse than uncertainty. And unfortunately, that's where we are still today with the virus. I have been saying, until we have a handle on the virus itself, any economic impact estimation is speculative in nature. But it's important to be doing that. There's a lot of great work being done nationally to try to gauge the severity of the impact as it feeds into the stimulus package we can talk about in a moment as well. But it's that uncertainty that still looms large. And as a result, I say that the single best economic strategy we can be doing right now is to help to end the virus, because until we have a sense of control over the virus, that uncertainty will remain and will continue to plague our markets and our ability to plan ahead. We worked closely with Boston Consulting Group and Shell in Seattle, and Governor Gregoire's great leadership through that organization as well, to get a handle on who are those workers that we thought were going to be most immediately hit. And this slide attempts to frame that a little bit. Unfortunately, I also think it's useful to emphasize that this is not exclusively a small business challenge. Medium-sized businesses and larger businesses, we know, are also gravely affected with this challenge right now. There is a need to focus on those most immediately hit in a couple of reasons. One, those service workers and the restaurant workers and the small business workers oftentimes have mentioned, not just the small business workers, but across the service industries, the wages are lower. The employees may have less savings and may be less likely to be able to weather this economic challenge. So they were the immediate front lines to have to file for unemployment claims, those sorts of things. There's also a fair amount of people in the 10% plus range in what is referred to sometimes as the gig economy. They may be uninsured for unemployment insurance themselves, though kudos to the state. I don't want this to be theoretical in nature. The state has responded very, very well. You can go to their website and you can see new rules and new accommodations for many employees that were treated differently prior to this virus. So the state, I think, is doing all they can do to adjust to the new reality that has come with folks affected by the virus that maybe previously would not have been covered by unemployment insurance. So we were projecting that there'd be unemployment claims. And just yesterday, the state published their most recent data on unemployment claims in Washington state, and it's quite shocking. As you can see here, in the week that ended on March 21st, which was 6 days ago now, these data were just released yesterday, unemployment has spiked to levels never envisioned before. My back of the envelope estimates, while I crunch these numbers and track them, if more unemployment is, keep in mind that giant spike at the end with more than 130,000 new unemployment claims filed, that ended on March 21st. So that is 10 full days of unemployment claims yet to be filed for the state of March. Some conservative estimates of what that trend might continue to look like would suggest by the end of the month, statewide unemployment rate will be at about 11%. And that is shocking given the fact that just 1 month ago, we were looking at historic unemployment rates, and the conversation amongst economists nationwide for the past year had been that unemployment was far below what people even thought was theoretically possible. So it's puts a big challenge on the state, puts a big challenge on our unemployment system, and the quantity of those unemployment claims is quite staggering. These data were in our report as just to try to understand the number of people affected in those industries to be most immediately affected. And by no means do we think that this is inclusive or comprehensive, because every industry is affected to a certain extent. We also felt it necessary to start to get people thinking about the impact on the public sector resources. All of the money from unemployment insurance programs to help cover unemployment losses, and our state is so dependent on business revenues and retail spending that is going to take a big hit. Here's some data just to gauge that a little bit, and this is getting closer to home for Seattle. In 2019, the total taxable retail sales was $30 billion. Now, these numbers that I have here are not derived from actual impact data, but it's trying to scale an understanding of what the impact to this might be. Roughly half of that $30 billion in 2019 is what I would call customer facing, those types of industries that have been immediately shut down. $3 billion in taxable sales alone for 2019 came from restaurants and bars. So even if on 2020, for the entirety of the year, if we lose just 20% of that customer facing retail, then we would lose $3 billion in taxable retail sales. And that's not tax revenue, mind you, that's just the sales themselves that are derived from that 9 to 10% tax rate. So it's a big hit on public revenues. It's going to be very challenging for all governments in the fall and throughout the summer months to come to terms with both increased spending and decreased revenues. Travel and tourism impacts. Unfortunately, again, this was all speculative and worrying in nature when we were writing the white paper for the chamber, and much of this has played out to be even worse than I think we were theoretically expecting. The airlines, the hotel industries, I've been on several panels and heard very, very sad and difficult, challenging stories from many hoteliers and restaurants in Seattle that are trying to weather it. I am appreciative of all the efforts, social media and outreach to keep restaurants in business with the takeouts and different models and those things. I think that's energy well spent. Another great concern is the global supply chain, and we'll talk about that in just a couple more slides as I wrap up here, but our maritime industry and our manufacturing industry and food production, they rely on products coming in from around the world. And a lot of these wheels were set in motion in December as the virus spread throughout much of the global supply chain in China. So it's important to remind ourselves of just how important China is as a trading partner and how that global supply chain has been disrupted. I spoke a little bit about economy-wide concerns a moment ago when I was talking about the concerns about the public sector revenues and the budget challenges ahead. There will be many businesses that cannot recover. When we talk about one of the biggest challenges of small businesses is how well capitalized are they. When you see those data about small businesses having a low survival rate because of low capitalization, that's in normal times, and it's very few businesses that have the assets on hand and the liquidity to prepare for this kind of a shutdown. There will be some that can recover, but there will be many that cannot, and we're seeing that play out, of course, with some of the data that we've been talking through. Finally, to get a little bit more constructive here, what are the economic interventions that are necessary? Again, this was all hypothetical in nature, and we've seen almost all of this play out. That's going to continue to place a burden on those backstops to the economy. I'll talk about the federal package here as I wrap up, but it's really putting a lot of pressure on anybody who owes anybody anything is how I think about it. So it puts a lot of pressure on the landlords, whether it's residential or commercial, who then need a lot of help from the financial industry. I think most folks are saying that coming into this, we were very fortunate that the financial services was in a strong position prior to this crises. Their balance sheets were strong, so they can provide a little bit more buffer, a little bit more flexibility before the federal government has to kick in, though it's certainly going to take a lot of both of those forces. But that's where it goes, is the financial services industry and the federal government working together to ensure as many transactions can keep flowing. What does recovery look like? This is where I think we would benefit from more conversation from businesses out there. We need to understand, what does that startup look like? I typically have been talking about it as end of virus plus 2 to 3 months. So until we know when the end of virus is, or when the social distancing can end, and when some semblance of business activity can begin again, it's that point in time plus 2 to 3 months for businesses to get back to normal operations. By normal operations, I do not mean normal revenues or any form of restoration. I just mean general activity. And those industries that have a supply chain are going to be harder to stand back up because of the delays and the different ripple effect of depleted inventories, lost workforce, and bringing those businesses back up to speed. I think the federal debt package will help. The $2 trillion that has been discussed equates to about 5% of gross domestic product from 2019. Many economists from JP Morgan Chase, the big Wall Street banks that have so much at stake with this level of analysis, have been forecasting an annualized decline of GDP in the 7% range, which again is just unheard of when we argue over growth of 2 to 3% growth for GDP. Then growing by only 1% in 2020 would have been a very pessimistic outlook just a few months ago. So an annual decline for US GDP of a negative 7% is a staggering change. That $2 trillion package will offset a lot of that. It certainly won't make us whole, but it will be a big help. And it's all about execution. Will that money find its way to the right places to sustain as much activity as we can before disrupting businesses and supply chains in an irrecoverable way? So that's what we need to focus on next, is how to put that money to use, how to keep those businesses alive that we can, and how do we rebuild as soon as we're able to know when we can do that. I'll stop there and hand it back to you, John.
Thanks, Chris. Really appreciate your insights and analysis. And I wonder if you have a perspective on the ability of the traditional economic relief tools at both the state and the federal level to respond and have enough flow through fast enough to the extent of this crisis. And that sounds like a leading question, and maybe it is, but you showed that chart on just the unemployment claims in our own state, and that's playing out across the country. And are the old tools up to the task?
Well, not entirely, right? It's just asking too much of any system to restore and keep this economy whole. And there's a couple of reasons. One is our economic engine had been running and revving very, very high the past few years. This is the longest economic expansion in history. So coming into this, we had a big, robust engine. And to now have such a reversal with such a devastating shock, there are just many businesses that the money can't get there quickly enough. There's just no way, right? A lot of folks have already hit that tipping point and past that point of no return. And it's really happening day by day right now. Today is March 27th. Most businesses that have employees that they've not yet laid off, they are now facing the choice today about whether to pay rent or pay their employees. And they will suffer that painful decision right now, and then they'll breathe for a little bit. But it's every month when those rent payments are due or payroll is run, and payroll is run more than monthly, of course. That's when that's when that intervention is needed. So folks now are scrambling to figure out, what cash reserves do I have to help cover these transactions, Am I willing to take on debt to cover some of this? What's my bet of restoration? Will my workforce be there? It's every day right now that it's super critical.
Great. Well, thank you again, Chris. And we're going to move now to Sean Bills. And we intentionally did not, no offense, Chris, but we intentionally did not conclude with you. We're going to conclude with Sean, who's going to speak to some relief we do hope is on the way. Again, Sean is the state director for Senator Patty Murray, and asked Sean to give us some insight on the federal package that's already made its way through the Senate, and we hope shortly through the House, and to give us some insight on the conversations in DC and what may come after this massive and historic stimulus package.
Thanks, John. First, can you hear me okay?
We can.
Awesome. Thank you again. Sean Bills here from Senator Patty Murray's office. And if you were able to name the mountain in the background, one hint, it is not Mount Rainier or Mount Adams. You win a prize at the end of this by emailing me, and I will give you my email address. I'm going to take a step back to January, work through where we are today, and then forecast forward. Additionally, you won't hear this from elected officials' offices that much. I'm going to try to be succinct and brief because, frankly, being selfish, it is more useful for Senator Murray's office to hear your questions so that we can better figure out how to respond to them, because I know your questions will be similar to those that we'll hear from folks throughout the state. So COVID becomes part of our general knowledge base. We understand what's going on in China. People are ramping up. Patty's back in DC. We're starting to hold hearings. We get into mid-February. Hearings are getting angrier. By February 25th, she's, for her version, yelling at Secretary Azar, saying that our response is 100% inadequate. We know this is coming, and the communication coming out of the administration is mixed at best and unhelpful. Fortunately, we have states and local health authorities stepping in to make tough decisions in the moment to try to help stop the spread. And we can't thank King County, the city of Seattle, cities across the state, since I heard we have Vancouver on here potentially, and then of course Governor Inslee enough for taking actionable steps to try to stop the spread. And I'll go into a little bit of a Senate office version of this. I think it might be useful for you all. So we were operating as normal and typically in the Jackson Federal Building on 1st and Madison downtown. March 3rd comes and we are alerted that some of the security personnel that share our building are have potentially been infected because they also work at CTAC. Senator Murray then needs to make quick decisions like every small business and every large business around the country needed to do at that point in time. We almost immediately moved to telework, which has been extraordinarily challenging from a congressional office standpoint because so much work is done face-to-face. So we shift our entire Seattle operation and then quickly Everett to telework. Within a couple weeks, so by March 12th, there are cases reported in the United States Senate offices. At that point, our entire operation, including those that are negotiating at the committee for Senator Murray and in her personal office and herself, are teleworking, which is 100% different than how any of these things have ever been done in the past. This is a very face-to-face business where negotiations are happening in real time, oftentimes on the Senate floor, which became almost like a ghost town. So we are all learning how to operate in the world of Zoom and teleconferences in real time. Frankly, the first time I used Zoom was earlier this week when we were starting to talk about this call. And what I would say when I started talking to y'all about this call on Monday is wholly different than where we are today. So that's just sort of a little bit of where we're at operationally, and we're learning. What Senator Murray is out there saying right now, and I'll use a few acronyms, the Senate in unprecedented is a overused word, in this case, unprecedented fashion, passed a $2 trillion package we're calling CV3 earlier this week. 96-0. Senator Ted Cruz voted for it. That is remarkable. There was hope that this morning the House would be able to pass by unanimous consent, so that's without any members objecting, this package and get it over to the president to sign. And we are, knock on wood, fairly certain he will, but I just, until it's done, it's not done. Some of the more conservative element in the House has been raising flags that they will not allow a UC to go. So this is going to require the House to get a little creative, and they're going to try to pass this package by a voice vote. I should say that they're in recess right now, and you may have seen or heard what your local member of Congress is doing throughout their districts, but many of them are not in Washington, D.C. A voice vote will require, allows this to pass out of the House basically by people shouting out yay or nay, and the presiding officer determines that the yeas have it. If somebody requests a roll call vote based on that, then there actually have to be a majority of members present to pass the legislation. So right now, the speaker and others are going through some fun math to figure out the best time to try to accomplish this. We're optimistic it'll happen sometime soon, hopefully today. Pretty optimistic on today, so that this large injection of resources starts getting out into communities. The package is, it's $2 trillion. It is a very large investment in every sector of the economy and every aspect of how we're responding to this, this disaster. I'm not going to go into detail on it because I'm certain all of you have read about what is in there online. What I will say is that we're putting up summaries as quickly as we can and press releases at murray.senate.gov. You can go there to get the top line details and then start figuring out where you have questions that need further answering. So we get this thing to the president, he signs it. There's more work to do before it starts flowing out, I think, as was alluded to earlier. Agencies, the Small Business Administration, they're going to need to pump out guidelines to get the resources flowing. So it's not instantaneous. It's going to happen as quickly as possible, and we are going to continue fighting aggressively to ensure that it is implemented as quickly as possible. That said, this happens, resources start flowing, we're going to learn. We're going to learn what we could have done, should have done, and would have done if we had more time or the ability to effectively argue for a program to be included. There are many things that fell off in the negotiations that should have been in there that Patty Murray would have supported, but that we just were unable to accomplish. The bill wasn't perfect from anybody's perspective. So I think she will be aggressively beginning to talk about the need to push out the resources in CV3, see what's working, but then also continue to look forward on the horizon to what we need to do for a CV4 and what the communities need, what King County needs and all of their cities need, what Vancouver needs, what Washington State needs. The needs are not going to go away. So this is where me kind of flipping the script a little bit and wanting to hear during the Q&A what programs you currently need more information on, also what you think communities need or businesses need from this group will be extraordinarily helpful for us because we are going to be trying to take that information in and then push it back for the next round of negotiations. I'm pretty close to the business community. So anything and everything has been, if one thing hasn't been made more clear, it's the amazing desire of people to do good. And my boss speaks in anecdotes. So one of my favorites that happened to us, just random story, is my wife is from Utah. Her best friend texts her and says, "Hey, I got a random email from a guy I kind of know in Lacey. He's a GM at a Home Depot distribution center, and he thinks he heard that your husband works for the government." That's the information they had. So anyways, I ended up getting in touch with this person. They were sitting on a stockpile of N95 masks and wanted to donate them, but might be shipping them out of state because they didn't know where to go to in Washington state. We're easily able to plug them in with the state distribution process, and that equipment gets into distribution in Washington state. So when I hand out my email, it's for things like that. It's to answer questions. I really do want to hear from anybody and everybody. And I might not have an answer, but we have a lot of staff working on getting answers to people and just trying to help folks get through this. So I'm Sean, SHAWN_Bills, like the Buffalo Bills, although in fact I am a Seahawks fan, at murray.senate.gov. And I'm sure that can be shared out some way by somebody smarter than me at this technology. With all that said, if Senator Murray was on the phone or on this webcast right now, she would just thank all of you for what you're doing in your community, ask you to continue to follow the best guidance that's being put out there by the experts, scientists, and your local health authorities. And with that, I will turn it back over, knowing that I've been very top line so that we can delve into questions that you all have. Thank you so much.
Thanks a lot, Sean, for your insight today, and then for also sharing your contact information. I know there's a lot of interest in trying to better understand the massive federal package that hopefully gets through the House today, as you indicated. I wanted to just put one question to you briefly, and then we're going to open it up and go through our Q&A box here. But is it your sense that on both sides of the aisle that federal leadership believe this as one of many future steps and additional packages? Is that a belief that you think is shared throughout the federal government?
You know, it's hard to speak for any other members of leadership, but I do think it certainly appears that that folks realize that we're going to need to do more, and we may not even know what that is yet, but that the relative speed, and particularly in the speed for congressional action that CV3 was passed, is going to require follow-up. And so I think you will quickly see members working on that. In Senator Murray's case, her partner at the Health, Education, Labor, and Pensions Committee, Lamar Alexander, her and him work closely together on these things, and I am certain that they are going to start discussing what steps they see as being needed next, and I am certain that Senator Alexander would then be working with Senator McConnell and others to try to advocate for those things. So the telling point for me is seeing a vote that's 96-0 on an again unprecedented level of federal investment.
Yeah, well, thank you.
Yeah.
Rachel, a couple of questions that I'm going to try to package and send your way if you can join us back with audio and video. One around, how are you thinking of the end of the virus? What does that look like? What are the data points that public health is looking at to suggest that we can start to lift some of these guidelines? And then how should we be thinking about the potential return of this virus, as we saw with the Spanish flu 100 or so years ago?
Sure, I will do my best to answer both those questions. So I think, you know, it is very hard to say in terms of how the sort of wind down of the outbreak of the virus is going to happen in our community. We are looking at places like China to see what has happened there. But when you look at the modeling that we have and some of the recent research that has come out, you know, we are looking at probably a couple of more months, frankly, of wind down, and then to be sort of getting somewhat back to normal, and I will put that in quotes, in the summer. As I said a moment ago, I think, and you heard again this from the governor before, yesterday, I think that there will be a push to lengthen some of these community mitigations. And really the theory there is, you know, the more that we can flatten out the curve, the more quickly we can get back to going out and being in our community and starting back up our businesses. So it is frankly a moving target right now, but the more we flatten the curve with these significant community mitigations that we have made, the more quickly we will be able to get back to what we're doing, or back to our normal lives. As far as the return of the virus, we have not, I think because we're kind of in crisis mode right now, we have not been that forward looking, although many of our researchers have been, but I mean sort of here, King County Public Health. But obviously, when we can get out of crisis mode, I think the most important thing will be to start working on treatment and vaccine. That the lack of pharmaceutical remedies is what has caused us to have to do all of these community mitigations. If people could go into the hospital and get treatment, if people could get a vaccine, this would not be having the kind of impact, both in terms of the mortality that it has created and the drastic measures that leaders have taken to deal with the spread. So that is going to need to be the thing that we are laser-like focused on just as soon as we can be.
And then in regards to testing, there's a question about testing. What's the optimal level of testing? How far away do you think we are from having the capacity that King County Public Health would like at this time?
Yeah, I mean, as far as optimal testing, I would say that everybody could get tested. I think there's two important points about testing. One is that testing for the individual to understand, what, if any, healthcare actions can be taken for that individual to make them more comfortable. Things in terms of that individual being able to know who they've come in contact with. So testing for the individual is critically important from a healthcare and a spread of the virus perspective. Testing is also critical from the understanding of this pandemic and the sort of scientific aspect of this, so that we can begin to understand which one of these community strategies work. How is the virus spreading? I think a lot of folks have probably read or heard there's giant question marks around children. Children don't seem to be getting the virus in the same way that middle-aged and older adults are, but are they spreading it? So we really need to have testing for both of those things. We need it in terms of the individual, and we need it in terms of understanding the disease. So in terms of how much testing do we need all the testing. In terms of how quickly we're going to be able to have more testing in our community, again, we're really kind of on two tracks here. I think there's the track that we are working with the federal government, albeit, as I said, with challenges in terms of getting those tests, getting them turned around quickly for this community. And then also just developing our own capacity here, which again, as I mentioned, we have the lab capacity. It's really about we need a big shipment of swabs. We need to either be able to create the medium that the swabs go in ourselves, or we need to get more of that resource. So we're going to be doing both. We're going to be doing both as we move forward, both tracks of testing.
Thank you. Sean, a question for you around the relief to small businesses in the federal package. And there's been a lot of talk about SBA loans and that some of those might be forgiven. But I think a lot of uncertainty that we're hearing among the small business community and the business community in general here in Seattle, and the ability for those entities to take on loans versus grants or loans that will be forgiven. Is that appreciated in your office, and how did the bill come down on this balance between loans and grants and the capacity for small businesses to pay this kind of debt back?
Yeah, that's a great question. And we heard over and over again from across the state, from small businesses and nonprofits, that they were very thankful for disaster loan assistance that was already put out there for SBA programs that are currently existing, but that they couldn't figure out how to make the business model work, taking on additional debt to get through this, and then just having that hanging out and when they are trying to ramp back up. So this is one of the things that Senator Murray was very focused on, and why, frankly, we had to hold out to improve upon the originally introduced legislation that was a more partisan effort, because it did then lead to the inclusion of some so there are some loan programs. Overall, there's 350 billion in loan forgiveness grants to small businesses and nonprofits in there, and those are a loan that will be forgiven if they're utilized for specific purposes like payroll, in some cases rent or mortgage and utilities. And again, we can continue to provide more information on the specifics on those. There's also a $10 billion SBA emergency grant program that was included. And so that's $10,000 grant, which isn't a ton in the larger scheme of things, but for some very small businesses, that might be extraordinarily useful in the very short term. And then there's a $17 billion bucket of funding to cover 6 months of payments for small businesses with existing SBA loans. And that can include the interest and the principal. So again, it was a huge focus. We went from a package that was basically, again, focusing on just on loans. We heard a ton of incoming that wasn't going to be enough, frankly, for many businesses and nonprofits. And so she went to work aggressively on that. It probably is one of those things we're gonna have to look at again and see where we're at upon passage of this, getting SBA up and the resources so that they can process all of the incoming, because there's going to be an aggressive surge of people looking to utilize these resources. And so we need to make sure there's somebody on the other end of the phone or the email to process the applications and get the funds out as quickly as possible.
Sean, one additional question for you related to the Families First Coronavirus Response Act. Are you able to address some of the nuts and bolts of that, and specifically the responsibility placed on the employer as an added expense, or could you potentially take some of those questions offline and point folks towards resources?
Yeah, I think it'd be easier for me if I had the specifics, and then I could point them towards resources, because there have been changes and then changes made to changes. So it would be helpful to be able to just have a conversation on that.
Great. And Rachel, back to you. There's a question around the how the virus is being managed within the homeless population, both in our low-income housing facilities, shelters, and elsewhere. Are we seeing a significant number of cases, and what have been the strategies to mitigate and prevent spread?
Yeah, that's a great question. So we are doing a number of things. So first and foremost, and this is something that we did honestly as one of our very first actions, was began to move vulnerable individuals out of shelters. So whether we were moving folks, just giving them hotel vouchers and getting them into hotels. Folks may have seen that we made the King County Airport, not SeaTac Airport, but our airport, the arrivals gate, we just made that available for a new shelter area, again, for those vulnerable individuals. So we worked very closely with shelter providers to say, okay, who falls into that category? We need to get them out as quickly as possible, because those are the folks who we know are going to be most susceptible to the disease. So that was one thing that we did. Second, we have been working with the city of Seattle to de-intensify shelters. So really creating more spaces so that people can spread out and have more space around, whether they have mats, cots, or whatever the facility has available to them. So we worked with Seattle and opened a number of community centers, Fisher Pavilion, places like that for this de-intensification effort. We looked at some of the facilities that we're standing up from the King County perspective to also move folks into. So that de-intensification effort. 3, we have worked with the providers, and actually I just got a bunch of material that just came into my inbox this morning, providing them sanitizer, cleaning guidelines, and information so that they are knowledgeable of what they need to do when somebody says they're positive, has symptoms, et cetera, in a homeless facility. And then we have also made adjustments. So like one of the things that I think, was sort of a unique idea, we have a shelter in Harborview Hall, we actually leased another building down the street, moved the shelter into that building so that we could use the ground floor of Harborview Hall potentially for hospital surge, so that Harborview had a place directly outside of their own doors for more hospitals. So we're really looking at all of our assets and trying to utilize them in the best way that we can. I will say there's a lot of nervousness in the homeless community, both for individuals and providers. You know, it's sort of like everybody feels like we're just waiting for that outbreak, and we have that nervousness as well. That being said, I think we're ready. The reason we've been standing up these isolation and quarantine facilities and are in the process of standing up these assessment and recovery facilities is to deal with that outbreak the minute it hits. So, you know, being able to move people into a place where they are separated and can be safe is our top priority. So I think we're doing the best we can to be ahead of the curve there.
And John, I would just add on the CV3 side, the package includes $7 billion nationwide for housing, affordability, and homelessness services. So there's an infusion of capital there as well.
Can I just add one more thing to that also, John? I think, you know, and this is just being really honest here. I think there is, if an individual tests positive in a shelter, you know, we have to bring all of our humanity to this issue. If somebody is COVID positive, they're going to be in a shelter, they're going to be on the street, or they're going to be in one of our facilities. And so we just really have to bring this to the individual level and say, how can we help this person so that they are not on the street having a virus that may kill them? So it's tough. It's very, you know, this is a very tough one.
Rachel, if folks have PPE, other equipment, supplies, donations for healthcare workers to support the healthcare system, what's the best way that they can provide those?
Yeah, so I will get a contact to you, John, for King County Public Health. And yes, please, if anybody has access to that material, we need it. We need it desperately. And I think, you know, I think we are really proud and pleased at everybody who is looking at their own operations and seeing what they can do to help in this virus. So I want to say thank you again to that, to the folks who are doing that. But yes, I will get a contact for public health so that we can get that going.
And there's been a lot of conversation about the potential for a surge, or sort of when we're going to see peak. What's the current thinking around King County Public Health and the healthcare system around the date of a surge or a peak in cases?
Yeah, again, and I hope I'm not coming off as opaque. It is really hard because we think our community mitigations might be working. So because, you know, we have all seen that exponential curve and have seen, you know, the weeks that it takes to reach that and then to come down, but we're not seeing that exponential rise right now. And again, big caveat that may be because we don't have enough testing capacity in our community to have a full picture. But if what we're seeing is correct, then you know, the more we flatten the curve, the you know, we're not going to have what has been seen as the typical up and down. So it is hard to say. That being said, I think, you know, we are in this for several more weeks before we hit the peak. We know that.
Mm-hmm. Sean, we've gotten a lot of questions, and there's been a lot of dialogue around tenants seeking rent relief from their landlords, which puts their landlord in a position of needing to seek relief from their lender. Does the federal bill address that, and how are the financial institutions being supported so that they can support the landlords, who then in turn can support tenants in this period?
That is a great question. And in the private sector, I know many lenders are working on programs actively now. So outside of the federal program, we're hearing from lenders that are willing to be partners in this when people call them up and talk to them, but that's hit or miss. I need to dig into the specifics on that one in this legislation and just haven't been able to get to it yet, but that's one that I could provide follow-up on the specifics of how this bill could support basically helping to ensure the backdrop of that outside of the SBA scenario.
Great, thank you. Rachel, you and Dow, I know are huge supporters of the major investments that we're making in light rail and stations throughout the region and have led on that. The question about any concern over the delay in opening light rail stations, other public infrastructure through the impacts of the virus.
Yeah, great question. So the governor's stay home, stay healthy order that was announced on Monday included construction. We sought and got further clarification from the governor's office yesterday on construction. So essentially, to boil it down for sort of the public part of that, is that public works, essential public facilities, or projects that can be public projects that can continue to be done safely are all included in what kind of construction can go on. We are working very closely with Sound Transit and with the city of Seattle to try to have as uniform standards as we can about what that kind of what safety looks like on the job site. We're also working with our partners in labor and with contractors on that. But, you know, it's going to be, we are going to have expectations that are very similar to how other businesses that are currently operating are operating. You have to have hand sanitizer on site. You have to have access to water for washing your hands. You have to be 6 feet away from the person next to you. So our hope is that we will be able, even if we have a loss in productivity or slightly less efficacy in how we're doing the jobs, that they will be able to continue safely for now. And then we'll have to regroup, I think, once we get into a place where folks can work more closely together and see what we can do. You know, there are a number of strategies that can be employed to speed up projects. Now, there are trade-offs to those things. You can work, you know, you can work shifts so that you're working 24 hours a day. If you're doing that in a neighborhood, it can get loud. So, you know, we'll have to discuss those trade-offs down the road. But our goal right now is to try to keep construction happening to the extent that it can happen safely, and only to the extent that it can happen safely. To, you know, the other benefit there is that we don't have to break down the job and then stand back up the job. But that's a work in progress to be able to do that safely.
Thank you. And I want to thank each of our panelists, Sean, Rachel, and Chris, for giving us some of their time this morning, and thank all of you for joining us. We are going to continue these virtual access webinars so we can provide you access to the information both on the public health and the economic side, and how we as a community can respond. I think it will take each of us as individuals coming together to help our community, our businesses, our public sector through this. And I do have hope that on the other side, we will be a more resilient, more closely connected community for it. We will follow up with a survey to you, and we really appreciate your feedback on how we can evolve these virtual access events and provide the best benefit and value to you. And we will include additional information in that as well, including Sean's contact info, the link to the dashboard that King County Public Health put out, and other ways that you can help. The Seattle Foundation, All in Seattle, have been great efforts of the nonprofit and private sector community coming together to support our community-based organizations and those that are most in need at this very challenging time. With that, I wish you a terrific rest of your day and a great weekend. Stay safe and stay healthy. Thank you.